Hello, welcome to Sonography-Radiology training channel. This series of videos is radiologic findings in fracture and dislocation of the shoulder. This is the fourth video in this video series with title of Inferior Shoulder Dislocation. The outline of this presentation includes introduction, mechanism, radiographic features, MRI, review of a few cases, and complications. At first, introduction. An inferior shoulder dislocation is the least common form of shoulder dislocation. The condition is also called luxatio erecta because the arm appears to be permanently held upward in fixed abduction. It's also famous as hands-up dislocation because the patient will often present with their hand placed on the head or near it. Mechanism of inferior shoulder dislocation. It's caused by either of the following mechanisms: sudden forceful arm hyperabduction, less commonly direct loading force on a fully abducted arm with an extended elbow and pronated forearm. Another mechanism is the humeral head is forced against the acromion, usually with resultant inferior glenohumeral capsule rupture and also rotator cuff disruption. Radiographic features. The humeral head is displaced directly below and slightly medial to the glenoid fossa, with the arm often in marked abduction, famous as luxatio erecta as I explained. This image is related to a man which fell from a ladder and tried to catch himself with his right arm. Patient was unable to put his arm down on exam. This frontal radiograph reveals the inferior dislocation of the humeral head from the glenoid fossa. Also, we can see in this image that the humerus is parallel to the scapular spine, which is the common position in luxatio erecta. An inferior dislocation can mimic a subcategory of glenohumeral dislocation known as subglenoid anterior dislocation, where the humeral head rests directly inferior to the glenoid in AP and lateral projection. But inferior shoulder dislocation distinguished from the latter by the humeral shaft position. In this subcategory of anterior dislocation, the humeral shaft is not parallel to the scapular spine, as you can see in this image. But as I explained before, the humeral shaft is parallel to the scapular spine in inferior shoulder dislocation. MRI. MRI is performed post-reduction. Common findings include rotator cuff tears, injuries to the glenoid labrum, injuries to both the anterior and posterior bond of the inferior glenohumeral ligament, and also bone bruises or impaction fracture, famous as Hill-Sachs defects at the superlateral aspect of the humeral head. You can find full explanation about Hill-Sachs lesion in this video. Now, review of a few cases. This chest X-ray belongs to a patient after falling while left arm held in abduction and external rotation. At first, chest X-ray was taken. The abnormality just visible on the chest X-ray is abnormal position of the left humeral head, and the pathology better seen on the dedicated shoulder view, which shows dislocated left shoulder. The humeral head is inferiorly dislocated, but technically it's an antero-inferiorly dislocation. No fracture is currently evident. Now, here is a question. Why it's not an inferior dislocation only? As you can see in this image, the humeral shaft is not parallel to the scapular spine, in contrast to the inferior shoulder dislocation. So, it's not an inferior shoulder dislocation only, and it's an antero-inferiorly dislocation. Another case, this patient fell from a tree. As you can see in this chest X-ray, the cardiomediastinal contour is normal, the lungs and pleural spaces are clear, But significant finding at the edge of the field of view is the inferior shoulder dislocation, with arm in a fourth elevated position, and also concurrent humeral head fracture with extensive comminution. In this case, the viewer may be alerted to the pathology by the wide awl perched on the clavicle sign, as you can see in this image. Complications of the inferior shoulder dislocation. Inferior dislocation have a high complication rate with secondary osseous such as humeral head fracture, soft tissue, vascular and neurological injuries, especially axillary nerve injury, tendon and ligament injuries like rotator cuff tears. Now, I suggest two others of my videos that are close to this video in terms of matter. And thank you for your attention.